Good afternoon, everyone, and good afternoon to the 90% empty chairs. Um, I am Dr. Khafeel Khan. I am a professor, Department of Pediatrics, Kamini Institute of Medical Science. Today, I am going to discuss about the health status in India and how we talk about the Kerala model. And yes, we'll talk about some lines in some drawbacks in the Kerala model. And as Anwar Salahuddin Sahab has told me the topic I will stick on how we can democratize and how we can, bring justice to our profession. How many are of medico here? Can you raise the hand? Only one. Okay. So that is my first slide. This is the brutal truth that our health system is broken health system. What I have experienced personally in 2017 when 63 children died in BRD hospital. That time I didn't know that this is the situation everywhere in India. And finally, down the lane in 8 years, I have realized that BRD oxygen tragedy was just a brutal face of our broken health system. So this is the brutal truth. The number don't lie. So everyone whoever is medico, one or two people who have raised, and rest all medical fraternity who are sitting here, please, we can't be mute spectator. People are dying and our own people are dying. India in 2019, actually when the Modi government came in 2014 promising that every Indian individual will be, get the best health facility. In 2019, they have put the target of 5% of GDP spending on the health expenditure. So 2026, what the budget, 2026 health budget is still, we have reached only 1.9%. The whole world is spending 6 to 8% of their GDP on health expenditure. In layman language, I will just tell you, out of 100 rupees, I am spending 2 rupees on our health. That's all. Less 98%. If I say something, people won't. No, they'll start calling me Deshdrohi. But how much we have spent on our, army. We don't have to go on that. It is not only Modi government. Even in Manmohan Singh government, although that time only we were spending 1%. So it's not that Modi government is spending less. It's all 75 years we have ignored our health system. The World Bank says 90% of the health needs to be at the primary level. India grossly invested. 47% of household, if I earn 100 rupees, I spend 47 rupees on our family health. That is a household medical cost, means 50%. Government is spending 2 rupees, you are spending 50 rupees. 400 million, that is 40 crore people don't have any insurance in India. We talk about Pradhan Mantri Ayushman Yojana and all, but that's the reality, and I am giving you the latest data. The medical tourism industry has become $10 billion. You go to metros, Delhi, you go to Kolkata, you go to Bangalore, you go to Ahmedabad. People from all over the countries, Gulf countries, African countries, South Asian countries, they're coming, getting it treated in a hotel like a suit and hotel like a hospital. But our own people are dying every day. I will tell you the example of Corona second wave tsunami 2000. Just close your eyes and remember that April 2021. when the metros, first time in Indian history, the elite class which thinks I am a billionaire, if I get sick, I will go throw money, I will get best treatment. The first time in Indian history, they also have to struggle for bed, oxygen, medicine. First time, the metros, Delhi, Mumbai, Kolkata, Lucknow, even your, Kochi, everybody was crying, the elite class. But reality is the 70% of Indian population. Okay, I'll go slow. Okay, okay. I am shouting. Hello? Okay. So, the reality is 70%. No, she's asking for pen. Ma'am, yeah. That pen she's asking. Yes, good. 70% of Indian population, they suffer the same thing every day. If you get sick, I'm not talking about Kerala, I'll come to the Kerala, but I'm talking about our UP, Bihar. If anything happen in the night, somebody is going to deliver some snake bite, somebody has fallen, somebody is having high-grade fever, somebody is having severe abdominal pain, where they will go? To the primary health center? No, it is closed. They will refer to the district hospital. They will go to district hospital. No, I don't have facility. Go to the medical college. 100 kilometers far. Half of them, they die on the way. And those half of them who reach, they struggle for bed, oxygen, medicine every day. That is the reality of our health system. 10% of the medicine which is sold in 10%, every 10 medicine we are taking, it is fake. That is fake. See, the data said 53 million, 5 crore Indian people every year, they go into in depth, they below the poverty line after spending so much in the hospital. Just imagine your salary is 50,000 or 1 lakh rupees per month, and you have worked for 40 years, and you have, you have worked for 40 years, your salary is 1 lakh, and you have saved around 50 lakhs to 1 crore, and you think your life will be good? No. Suddenly, your mother have cancer. Somebody has in the family has major illness. This big hospital, they will take this 50 lakh rupees in a 1 month. That is happening. 53 million. This is government data. It is not my. Modi government doesn't give data, which gives, I'm telling you. 8% PST, they don't have doctors. The WHO says 1 doctor to patient ratio should be 1:1,000. 1:1,000. You go to Delhi, that is 1:300. That is better than the US in Delhi. You go to Kolkata, it is 1:700. But you come to UP, rural area, it is 1:51,000. 1 doctor is taking care of 51,000. And see the PSC, 8% PSC, they don't have doctors at all. 75%, they say jhola chhap doctors, that unpractitioners. But I call them non-trained medical profession. That is the backbone of our health system. 70% of primary health care is taken care of these non-medico or what you call Bengali doctors or whatever. But they are also our backbone. Large tribe, this is the discrimination. Large tribe and Dalit communities in isolated area, they don't have access at all. We just talk about the metros. We go to the rural areas. See, this is index, Global Health Index. Out of 127 countries, we are on 105. Female health and survival. If a female gets sick, the parents will go to the medical store and get the medicine. They won't go to the doctor or health. See, we are on from the bottom, we are on the third. Like out of 153 countries, we are 150th in female health survival global road, every second female is anemic, every second child is malnourished. India has become every third who is HIV affected is living in India. India has become second largest country with diabetes. 16 lakh people are dying because of pollution. 8 lakh children are dying every year because of preventable disease. Means every hour 100 children are dying. So when I talk about my Gorakhpur 63 kids, that is one incident. Every hour 100 children are dying, our babies are dying, and WHO says preventable disease, preventable death. So the private sector is taking over. I have already talked about how the medical tourism has becoming. We have around 750 medical colleges, 350 are private hospitals. The cruel irony is India export medical service to the world through a booming 10 billion medical tourism industry, while 53 million, 5 crore of its own citizens are pushed line every year by hospital bill. So, now what we should do, this is all theory. I am speaking for the past, 8 years about right to health care and all. The only thing I tell that we need a good surgeon and I need a big surgery. We don't need a cosmetic, we will do this, we'll open this hospital and all. We need a major surgery to, save this health system. We have to spend at least 5% of our GDP. So we need bold reform. We need immediate action. So right to health care, that is the demand of every individual. It's not about medical fraternity. Every Indian citizen should ask, just like right to education, right to food, right to information. This is right to health care we talk about. Fix the primary health care. I told you 70% of problems can be solved at the primary health center level. So we have to fix the backbone, the reed ki haddi. I can go on and on, all this universal examination, all those things. I'm not going into this. Now come to the scapegoating. We have seen so many posters outside, and I have forgotten Fatima. I have forgotten, now we have Rohit Vemula Act is going to come. Najib is disappeared. Okay, how many people know about my story? So there are people who don't know also. Okay, I am very sad about that. So you read my book, The Gorakhpur Hospital Tragedy, is available on Amazon and Flipkart and Isoli. It's available in 10 languages. So what happened, those who don't know, I have done my MBBS MD from KMC Manipal, Karnataka. I have got 30 rank, all over 30 rank to get the admission. And I finished my MBBS MD from KMC Manipal, and I got fellowship in neonatology in Sydney, Australia. I was going to go, but as the parents from the rural background, they think that if the son goes to the outside India and to the other country, they won't come back. They put one condition: you can go to Australia, but you have to marry. And once married, nothing happened. No going anywhere. So that's what happened. 2016, I joined BRD Medical College. That is also in my hometown, government medical college. And I'm telling you, I was the only Muslim candidate in all over Uttar Pradesh who cleared Uttar Pradesh Public Commission and got the job. I was the only pediatrician, Muslim pediatrician. I joined in 2016. That is, screen is gone. Gone? No, okay. 2016 I joined. I was the senior resident. You must be here. I was the junior most doctor there. I was the junior most doctor. One night, one call came. children, that is a message in a WhatsApp group. We had a WhatsApp group of doctors. One message came, children are dying, no oxygen. One senior resident has sent the message in the group. And I have done in Manipal, I thought oxygen also can be finished. No, it's like electricity. If you are working in a hospital, that is, you can't imagine that oxygen can be over. So I just ran. And when I saw there, 1 year, 1 day, 2 days, 3 days, 5 days, all the kids are dying, all the mothers are crying, all the residents were, and no consultant, nobody came. The same what Dr. Lal was saying in the morning, isn't it? If you have heart attack, you should have a heart attack before 1 o'clock. That is the reality of Kerala also, no, isn't it? So after 1 or 2 o'clock, all the doctors go to the private practice and nobody is there in the hospital. You know, in night, nobody is there. So we got oxygen cylinder, 200 cylinder, 300 cylinder, 500 cylinder. 54 hours there was no oxygen. Because the oxygen used to come from where? Liquid oxygen? Rajasthan. So it took 54 hours to bring the oxygen to that college, and by the time 63 children and 18 adults lost. I believe a child is a part of mother. Just like you cut your finger, no? That much pain mother will have. That is the reality. Father, when I am a father, if something happened to my child, I will put this, bleeding will stop. But my wife will, even she is also a doctor, she will start crying. That is the pain mother has. And those 63 mothers, they saw these kids dying in front of them. And that's why I still speak about them, because I saw them crying. They took their part in their hand. That's what happened in that night. The media, which is sitting in Delhi and Mumbai, they saw some local newspaper, or Dr. Khafeel become Masiha. They did not go to know who is Dr. Khafeel. They didn't go to Gorakhpur. They just took out the story from a local newspaper. Oh, Dr. Khafeel is Masiha. Dr. Khafeel brought oxygen in his own car. Dr. Khafeel got cylinders. He is the Superman. He is this. For 2 days they made the stories sitting in Delhi and Mumbai, just like they want to viral everything. They, then what happened? It became blown out of the proportion. And when it blown, the same year, Yogi Adityanath Ji Maharaj was sworn in as a chief minister. So his chair was going to be gone. Who is responsible? Why that happened? Why that happened? 63 children died. Why didn't then the investigation showed 68 lakh rupees was not paid. That's why the supplier stopped the oxygen. Then they asked why they didn't supply the oxygen. Then they said that they wanted 10% commission. So 10% out of 68 lakhs, 6 lakh rupees, 63 children died. So he came on 13th of August 2017, and I still remember when he came and called, who is Dr. Khafeel? I thought I will get a praise or something, so I corrected my tie and everything, and hair was there that time. So I went there, and now we talk about responsibility. My HOD was there, my dean was there, principal, my whole medical fraternity was there, district magistrate was there, and that time this JP Nadda, who is now, he is again health minister, I think. He was their health minister. So tu hai Dr. Khafeel. So once he said to tu hai Dr. Khafeel, I thought something is wrong. Because in Urdu lehza, we say aap, we don't say tu. तो तू सिलेंडर लाया था? I said yes. तो तू सोचता है सिलेंडर ला के तू हीरो बन जाएगा? देखता हूं तुझे. These 4 words, you think you bringing cylinder, you will become a hero. That's all. That's 4 words has changed my life. People thrown me into the prison. 9 months, nobody knows where is Dr. Khafeel. Initially, everybody cried. Dr. Khafeel, but after some time everybody forgot. Then I wrote a letter from the jail and I narrated the story, what happened. And I'm lucky to say that, yes, the court, after 9 months of incarceration, they realized that Dr. Khafeel is a doctor and they acquitted me of medical negligence and I came out 28th of April 2018. So the problem is the Gorakhpur lesson says that who is responsible for this incident? A pediatrician? Is it my responsibility to bring oxygen? Or hospital administration? Or it's the whole rotten system? You have seen Jawan movie, isn't it? So in that system, that Dr. Iram is calling the dean and principal, everyone, but everybody is shrugging the responsibility. Anyway, when I came out, I thought like my life will be better off. But no, when I started questioning if I have not murdered those 63 children, who killed those 63 children? So my brother was shot in where the chief minister was there in within 500 meters. I was sent to jail again, saying that I tried to forcibly treat some patient, and then CANRC came. 29th of January, see how the system can behave sometime. 29th of January 2020 and 30th of January I went to Mumbai to address a program with Tushar Gandhi, that is grandson of Mahatma Gandhi, in the death anniversary of Mahatma Gandhi. And they picked up me from the Mumbai airport. Who picked up? Special task force from Uttar Pradesh. Why picked up? We will tell you. 29th of January they picked me up and they gave to the prison only on 2nd of January. And what happened in between? I am still alive. I feel sometime that is a miracle. Nanga kar dete the. One, they used to make me naked. Ek person, two people used to hold my legs, two people used to hold my hand. And then, srak. Itna marte the. I used to faint. I used to scream. Please leave me. Please leave me. Chhod do. No, you have made powder that will kill thousands of people. You have went to Japan to destabilize the government. I said, you tell Pakistan why you are saying Japan. They were not from STF. I still feel. Because I could see in their eyes the hatred, the red eyes, the drunk, the smell, the isolated buildings, the dark corner. And that happened not one time, 29th, 30th, 1st, 2nd. How many times I was fainted, unconscious, and how many times I found myself in that room or in that jeep from Mumbai to Aligarh, that is 2000 kilometers, 3 days, no water, no food. They used me as a, sometimes I feel. I remember when I reached 2nd of February in Mathura jail, the first thing I asked the jailer, उसके पैर पकड़ लिए मैंने. I asked, give me food, give me water. What? This is what? What I have to do? Okay. जेलर ने कहा कि अगर तुमको खाना चाहिए, पानी चाहिए, तो यू स्टॉप आस्किंग क्वेश्चन, यू स्टॉप टॉकिंग अबाउट योगी जी एंड मोदी जी. शुक्ला जी थे कोई. I said, just give me food, water. And they kept me, I thought I'll get food and water. But they kept me in a solitary confinement this time. और जैसे लगता था कि चाबी लगा के भूल गए, गायब ही हो गए. Nobody was coming. Nobody was coming for the next 2-3 days. For the first time in my life, I realized that pain is nothing. The most painful thing is hunger only. I am a doctor. I know that if you don't drink for 3-4 days, your kidney will go. You will have acute renal failure. Solitary confinement is a small cell where you will be all alone. I ate grass. I chew my shirt. When I used to go for pass urine, I could not pass even a drop of water. And my whole skin was so bad that I could not sleep on my back. And after some time, I could see chicken, mutton, burger, everything in the air, and I could run and to hold it. I used to scream, "Koi hai, khana de do, pani de do, koi hai?" And I used to faint. Anyway, that 4th or 5th of February, my brother came. And then I was shifted, and then I was got food. But government, when I got the bail, they put me another charges of National Security Act, and I was again in the jail for next 9 months. They asked me to stop talking. So I have written the book so that they should not ask. If the book is a document, I have written that book. I know that even after 100 years, when Yogi is not there and Dr. Khafeel is not there, the book will always be there. And this story which I have narrated here, I have not told anyone to my Union family. And I have finished my second book. That book is also going to come. Maybe again I will go to prison again, because writing that book again. But I have to write. Somebody has to speak. Somebody has to sacrifice. Everybody can't be a mute spectator. Remember that. Anyway, that is a... Now we will come to, that is, we are talking about injustice. Remember, I always feel lucky I survived. There are so many people behind the bar. There's so many people have been killed. You have seen so many posters hanging there. I am still alive. I am still talking. I am still earning. I am still handsome also. So, we talk about Kerala. So, this is the proof that political will works. Kerala is not lucky. It's about the work of 70 years of Kerala. Kerala chose, and that is both its pride and responsibility. That I talk about the Kerala model. So life expectancy is 80 in Kerala. The infant mortality rate is 5, and in RUP is 37. That is, any child born in UP the chances of dying that child is out of 7 times more than Kerala. If 5 babies died in Kerala, 37 was going to die in UP. The same way maternal mortality rate. Giving birth is a normal physiological phenomena. You must have seen so many videos in tribal area. Mother will go, they will give birth, they will take out the placenta, take the baby and go. But in that also, see, 167 female die in UP. But in Kerala is excellent, is 19 now. That I will really commend it that maternal mortality rate has come to 19 per lakh. And NITI index, that is the highest body in the India, has given 82 marks out of 100 to Kerala and 30 to UP. So Kerala got distinction and UP got fail. So why this happened? Public investment, that is the consistent decades long public investment. UDF, LDF, whatever, but is happening, you know. Decentralization, the Panchayati Raj, which is mainly genuinely empowered. That's why I always emphasize on primary health center, and that's what Kerala did. Strengthen the taluk level primary health centers. Social movements, like we are talking, even though I thought the election is over and everybody will be tired, but still we are sitting and talking. That is the movement, you know. Anywhere if you go, once the election is over, 1 year no movement, everybody will sleep. Primary care first, female literacy. I see, mother is the first teacher of the child. Mother is the first generation. Highest female education. That will prevent the infant mortality. In our side, UP, Bihar, if the mother, the female child is 15, 16 years old, past 10 plus or 10 plus 2, they will get married. They will have 5, 6 children. Again, they will get married. The cycle goes and on and on. But here I have seen all the females. Yeah, I'll finish fast. Okay, so now we have to talk about Kerala model. Oh, he's going to take picture. I thought he's signaling to finish. Okay, so we have talked about Kerala model. Let's talk about Kerala's failure only. This is, these slides I have suggested by Mr. Shihad, I don't know where he is, the City Heritage owner. He said we talk about good thing always. Let's talk about the failure also. And he said that we started talking about Punjab is the drug menace. You know, the Punjab is the first Urta Punjab. But when I researched last night, we found that Kerala is flying. You know, Urta Kerala has become. So because pride without honesty is propaganda. Remember that. We cannot accept our past victories as permission to cure. So this is shameful question. Now 66%, see 66% of what you are spending in Kerala is also private. We have decreased the maternal mortality rate, but in Kozhikode, what is Calicut, when the mother goes to any private hospital, they have to spend 50,000 rupees for a normal delivery. That is the stark reality. The shameful question is, we celebrate our maternal mortality rate of 19, but I has already said. So this is Kerala's OPP. That is out of pocket expenditure is 2,666. It's way highest in Karnataka, Telangana. I am not comparing with UP, okay? If you are comparing with your lowest student, you will always be happy. You have to compare with someone with your Karnataka and Tamil Nadu also. Now come to this drug menace. 30,000 cases. 30,000 cases in a year. 25% of all drug cases are in Kerala. Especially thus, MDMA, synthetic drugs are there. Sniffing. No? And drinking alcohol, see the lowest rate. 13-year-old child is drinking alcohol. 13-year-old they start drinking in Kerala. That is your reality. So, Punjab is not Uding, Kerala is Uding. Okay. So now we talk about mental health crisis. Kerala has become the largest state in India with the highest suicide rate. 11,000 people. 11,000 people died. You know? No, we're talking about, okay, we'll come about mental crisis. Yes, mental. Yes, around 11,000 people died, I think. No, 792 drug alcohol related. Yes, 5%. 5% people. And, the we curtain that communicable disease, malaria, dengue, diarrhea we have put. But what we have gave to our population? Diabetes, hypertension, that non-communicable disease, obesity. So we defeated communicable disease and walked into the NCD, the non-communicable disease. And yes, one more thing I want to talk about. Yesterday we went to Shantapuram. It's 70 kilometers. Going is 3 hours. Coming back again 2.5 hours. The road is two-way. There is no divider. Anytime you can have accident. I was very scared. So, narrow widening single lane roads with no divider. Designed for bullock carts and everybody is using SUV. Isn't it? And even the bikers, they are not wearing helmet. So, 44,000 accident in a year. 50,000 injured. Every day 10 Malayalis are dying. Every day 10 Malayalis. We cry if somebody dies. It comes in the news, it comes into your social media, reels and shorts. We started demonstrating. We go to the district magistrate, demonstrate and do dharna and all. But every day 10 Malayalis are dying because of the road itself. That is the stark reality of Kerala. So we have built world-class hospital, but we have built world-class trauma center, but going to the trauma center is a narrow road, so ambulance can't go. If somebody has Gulf migration, 1 million females, 10 lakhs females, they marry and they go to Gulf. Now the girl, the female has the responsibility to take care of in-laws, except Kannur. They say that girl goes to, the boys goes to somewhere. So, 10 lakh females have responsibility to take in-laws, finance, land, everything. So that is causing mental problem, okay? And yes, old people are here. Abundant elderly, I will say. So, I put it at the Gulf wives, so don't take it in a wrong way. I'm just highlighting their problem. It's also a pandemic. And you are now you are depending on slowly you are depending yourself on the migrant. Remember, I have given the Kuwait War 1990, when all the migrants suddenly gone and the whole system, the economic collapse. Everywhere you go, Bihari UPs are serving. And suddenly one day they will go, when somebody will become good chief minister and give education and employment, what he will do. So, Kerala exports is young and imports is disease. Somebody is flying, the youngers are flying, and the disease is coming. We send nurses to the Gulf and receive back loneliness, depression, and neglected elderly. The remittance does not cover that bill. So anyway, so what we have to do? We have to do blah, 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 blah. That's it. That we'll continue talking about. So this is our responsibility. You are not just clinician. You have to take responsibility. Dr. Khafeel Khan still speak against the injustice done to anywhere, any time, is because I believe if you have heart and that heart is beating, you can't see injustice anywhere. Thank you. Thank you. I'm sorry, sir, I have taken your part of time also. So, yes, last I was talking about this book. And yes, I am doing a lot of things also. I have written the Gorakhpur Hospital Tragedy, which is available in Malayalam, Telugu, Tamil, Kannada, English, Hindi, Urdu, Assamese, Marathi, Bengali. So it's available in most of the languages. And I'm writing this Gorakhpur Hospital Tragedy. Apart from that, this is Manipal Manual of Clinical Pediatrics. And writing a book is a task. Writing second edition is a big task. Third and fourth and fifth. In 15 years, this is my baby. And I'm telling you, every single page, because it's a medical book, even single dose error, even single drug error will cost somebody's life. So every line you have to think and put. That's why I have spent six months for each chapter. So this is 5th edition, and I'm proud to say recently we have launched 5th edition and we have crossed that 10,000 milestone. That means 10,000 MBBS doctors have read these books and become a doctor. So this, and one more book I have written, that is Ma. It's in Hindi, but I will, now I have come to Kerala and I'm very impressed. I will translate into Malayalam also. With AI agent, that is Project Ma, where it's an AI agent, where the mother can ask any question related to the baby. How I'll breastfeed my baby, how I'll give bath to my baby, what I will do if there is a fever, and the AI agent will talk. From my book only, he won't tell anything else. That is also there. So this book is not only for MBBS student, it's for homeopathic, Ayurvedic, or anyone who wants to take care of the baby. So anybody who is there, registered medical practitioner, is there on the reception, free of cost, complimentary copy you can take. And thank you, Fraternity, giving this opportunity. Really, Anwar Salahuddin and Nadil Bhai has helped me out. We have started with Trivandrum and we have reached to Calicut, and it's Nabil Bhai only, that he has managed each medical college. He has so many medical students in his phone list, especially all they are girls only. That is one thing. I don't know why, but that is true. Thank you. That is thank you.
Thank you, sir. Thank you so much for this insightful thoughts and your beautiful presentation.